Welcome to part 2 of my new series, Helping a Friend Who is Newly Diagnosed with Breast Cancer. Today we're going to be talking about a stereotactic breast biopsy. Hi, my name is Dr. Robin Roth, aka the Boobiedocs. I'm a board-certified breast radiologist, which means that I'm the doctor who will be interpreting all breast imaging and performing image-guided biopsies. In case you missed part 1, my friend had 1 centimeter of calcifications that exploded to 4.8 centimeters of suspicious calcifications in a 6-month period. So now they are recommending a stereotactic biopsy. A stereotactic breast biopsy is when we perform a biopsy under mammogram for calcifications or something else that is only seen on a mammogram. You are positioned like you're getting a mammogram, and a breast radiologist like myself will give numbing medicine through the skin and then in the deeper tissues. Once you're adequately numbed, you should really only feel pressure, no pain, even though this looks incredibly painful. I had one myself. It really wasn't that bad. They're going to take samples of the calcifications and they're going to drop a biopsy clip. And that part is so important because it lets your doctors know where your breast cancer was located in case it magically shrinks after treatment, which we are manifesting that to happen. So you can actually perform a stereotactic biopsy in one of 2 ways. At my institution, we have an upright table, so the patient is positioned in a seating position, and we are doing the biopsy from either the side or potentially from up here, and we have them kind of looking this way. Other institutions might have something called a prone stereotactic biopsy table, where the patient is laying on a table with their breast suspended through a hole, and the radiologist is working from underneath them. But either way, the process is the same with the numbing and what to expect. I would say a stereotactic biopsy usually takes under 20 minutes. It can take longer, and you leave the office with a little bandage on your breast. How long it takes for your biopsy results to come back really depends on the institution. At more academic centers, you're probably going to get more like 3 to 5 days, but it can be up to a week or longer in some places. I know my friend had to wait a long week for her result. Sometimes in cases such as this, when there's a large extent of calcifications, we actually want to biopsy 2 parts of calcifications that are far apart in case the patient wants to undergo breast conservation or lumpectomy later on. Historically, most breast surgeons would have shied away from doing lumpectomy or breast conservation therapy when you had greater than 5 centimeters of calcifications, but it really depends on the size of the breast and what you want your breast to look like afterwards. My friend has a very small breast, a lot of disease. She is probably going to be getting a mastectomy. Come back for part 3 where I break down her biopsy results. As always, follow the Boobiedocs for the breast information.